Yes, yes. And doctor, it's very clear. And in fact, I should tell you that I have actually personally downloaded the app. And then before this meeting, I wanted to see like how it is and how a patient can feel. And I made my husband also do it because he's not a doctor field. So I'll understand that how easy and difficult it is. It's very easy. And I must say that sometimes when we upload the photos and it is not right, the kind of response, the directly a message comes to your WhatsApp saying that this is the procedure, this is the video, this is how you should upload your photos. And the kind of diagnosis, professional diagnosis which it gives is also pretty much accurate. I should say that I never expected that a AI will have such a kind of accuracy. So how did you get that, and what do you think is the future of AI in dentistry?
Right. I was about to come there, right? The kind of speed and accuracy which you experienced along with a seamless journey of scanning couldn't have been possible if we did not have the kind of data which are proud to hold and the processes which we have set in the system. For example, a machine takes anywhere around, say, 50,000 to 70,000 odd photos just to understand the difference between central, lateral incisor, canine, premolars, and molars. So, in order to fetch and make these algorithms capable of understanding 36 hard tissue diseases, right, from stains.
That's a big pool.
A big pool, stains, calculus, malaline, fracture, pit and fissure, deep caries, whatever. We have trained almost about 1 million photos.
Oh God, that's huge.
Yes, and the earlier adoption or the collection of data was all manually. We conducted dental camps, we went in dental colleges. We had made a different app which was known as the DentalDost Interns app, where they were collecting data manually while they are giving consultation to the patients, especially pre-COVID and during COVID time. And of course, we had their consent because we'll be using this in our machine learning training cycles. And are you giving consent for us to use that data? Of course, in the back end, nothing is published. And so was the journey of the collection of first couple of lakh of images which we had put. And now training and retraining of the same data is where you see the accuracy going up. Second hurdle was to have a system where we are putting these images for training in order to put it in the machine to take it all in. So it's the right combination of dental surgeons trained to annotate and a right team of data scientists and engineers to take in all of that information and put it or create the right models. Right? That was challenging because dental surgeons in general, it was a lot of problem to train them to use these complicated softwares. Right?
I can understand. We are little technologically backwards. Not backwards, I should say, but we are not so pro in the technology and all those things.
Correct. We are the dental surgeons and medical professionals in general are a little bit challenged.
Yes.
We put it right? But we thought, okay, let's achieve one more milestone by making them technologically advanced and breaking these barriers of being challenged. And I'm so proud we could do that. And later, now we have automated the entire thing about how do we select the images which are of the right quality and facts which we need to put in the system. They are labeled, annotated. We have 3 level of moderations because we cannot put any data, right? So dental surgeons are doing it, and then we have 2 levels of moderation over that, and only then we give it to our machine learning engineers. They are putting into the system. The model is being trained again and again, and outcome has been experienced by you.